Club medical attention. The health center features 2 beds for short-term stay. Okay, hold on. Hello and welcome to the official commissioning of the new Health and Wellness Center in Mopo in Wesley. This is the fifth commissioning of health and wellness centers we have seen in the past few weeks. It began on the 12th. It began last month with the commissioning of the Murphy Esprit Health and Wellness Center in Maho. We moved to the Olivia Douglas Health and Wellness Center in Portsmouth, and then on to the nurse. It was on to the nurse Maria Moyes Health and Wellness Center in Bellevue-Chopin, and then the nurse Stella LeBlanc Health and Wellness Center in Viecas. We are here in Wesley for another grand occasion, the commissioning of this wonderful facility. A number of government ministers are present. I see the Minister for Foreign Affairs. I also see the Minister for Governance, the Minister for Foreign Affairs, of course, Dr. Kenneth Daru, Honorable Greta Roberts, the Minister for Foreign Affairs, the Minister for Public Works, the Honorable Kasani Laville, the Minister for Education, Honorable Octavia Alfred. I also see the Minister of State in the office of the Prime Minister with responsibility for finance. That is the Honorable Gregory Rivera. Honorable Rosalind Paul, the Minister for Sports, is also here, and so too is the Minister for State in the office of the Prime Minister with responsibility for telecommunications and broadcasting, Honorable Oscar George. Other ministers present include Honorable Kozia Frederick, Honorable Kent Edwards, the Senior Minister, Honorable Reginald Austri, Honorable Rayburn Blackmore, Honorable Dr. Addis King, and Honorable Denise Charles, as well as Honorable Shakira Lockhart Hippolyte. So a full contingent of cabinet ministers are present here today for the commissioning of this health and wellness facility in the Wesley area, in Mopo, Wesley to be exact. This modern facility will have provisions for urgent care and round-the-clock medical attention.
Ladies and gentlemen, please stand
the health
for the
center
arrival
features
of Honorable
2 beds
Roosevelt Scarrett,
and for
Prime
short-term
Minister of
stay.
the Commonwealth
We
of
just hear
Dominica.
the announcement of the arrival of the Prime Minister of Dominica, the Honorable Roosevelt Scarrett. He's making his way here at the facility this afternoon. So we'll go across now as we welcome and we see the entrance of Prime Minister Honorable Roosevelt Scarrett.
I invite you to remain standing for the national anthem.
Good afternoon. Let us all stand at attention as we sing the first stanza of the national anthem. Isle of beauty, isle of splendor, isle to all so sweet and fair.
eternal and most gracious God, we come in your presence to give you thanks for the many blessings that you have showered upon us as a people of this community and of this nation. We thank you, God, that as you have blessed us in the past, you are blessing us now in the present, and you will continue to bless us in all of our future endeavors. We ask a special blessing now upon our Prime Minister and his cabinet and all others who were involved in the health and welfare ministry and in the health and wellness mission of our island. We thank you for all who constructed the building, all who worked and labored and toiled, for all who successfully sought to see this come to a close to an end. We ask that you will give the residents of this village a loving heart to take good care of this facility for the good of all who seek health and healing. We pray, God, that we will be so proud of it that we will do nothing to make this facility be destroyed or be put to waste. We ask your blessing now as we go through this program. And we pray in the name of Jesus, our divine physician. Amen. Amen.
Good afternoon to everyone. I recognize the presence of the Honorable Wesley, Prime Minister of the Commonwealth of Dominica, Honorable Reginald Austri, Senior Minister and Minister for Housing and Urban Development, Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment, Honorable Fidel Grant, Minister of Blue and Green Economy, Agriculture and National Food Security, and Parliamentary Representative of the Wesley constituency, other honorable members of Cabinet, Permanent Secretaries, Mr. Ahmad Al-Khatib, Project Manager, MMCE, Dr. David Johnson, Chief Medical Officer, Dr. Laura Esprit, Director, Primary Healthcare Services, Mrs. Teresa Ravalier, Acting Principal Nursing Officer, Mrs. Magdalene Kovon, Alexander, Senior Community Health Nurse, Region 2, Mr. Brian Philip, Chairman of the Wesley Village Council, Mrs. Imelda James, Chillingford, Pharmacist, Ms. Imelda James, Reverend Evans Dawes, other staff of the Ministry of Health, Wellness and New Health Investment, other invited guests, members of the media, ladies and gentlemen, good afternoon. And welcome to our 5th commissioning and unveiling ceremony. I now invite Mr. Brian Philip, the chairman of the Wesley Village Council, to give welcome remarks.
Good afternoon to everyone. Protocol have been established. On behalf of the residents of this beautiful community of Wesley, I am honored and privileged to welcome each and everyone to this grand event this afternoon. Today, we all have come to celebrate this special and memorable experience. Health is a major aspect in every society, and as a community, we give praises for this major investment within our beloved community. Once again, welcome. I thank you.
Thank you, Mr. Philip. I would like to invite Mr. Ahmad Al-Khatib to give the project overview.
Let me recognize Honorable Dr. Wesley, Prime Minister of the Commonwealth of Dominica, Honorable Reginald Austri, Senior Minister and Minister for Housing and Urban Development, Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment, Honorable Fidel Grant, Minister Blue and Green Economy, Agriculture and National Food Security, and Parliamentary Representative of the Wesley constituency. Of course, other honorable members of the Cabinet, Mrs. Letita Lestrade-White, Permanent Secretary, Ministry of Health, Wellness and New Health Investment, other invited guests, members of the media, ladies and gentlemen, good afternoon. It is my pleasure to once again extend a warm welcome to you as we commemorate the unveiling and handing over of the Wesley Health and Wellness Center. As you are all aware, the government of Dominica has made it a silent mission not to only reshape but transform the healthcare system in Dominica. These remarkable structures you see in front of you will facilitate a new era of healthcare and wellness in Dominica. It is because of this that I'm really pleased to present each individual center to the people of Dominica and urge them to continue to celebrate every advancement of this beautiful country. And so, we have been informed also by the Honorable Prime Minister Wesley of the expansion and application of this program to include Roseau and other districts around Dominica, and we at MMCE are always ready and prepared to deliver. As it stands now, we've been working over the past of 18 months over 12 health centers. Let me name them quickly. We've already handed over 4 in Maho, Bellevue, Georgetown, and Vegas, with Marigot, Pemville, Bagatelle, Coliho, and Slimay, Sofia, and Newtown will be handed over in the coming days or weeks. In addition to the Marigot Hospital, which is being constructed as we speak, and it is at its final stages. We speak again about the health center. The composition of this state-of-art health and wellness centers will showcase the use of reinforced concrete structure and are all costumed with impact-resistant windows, equipped, of course, with all necessary facilities from doctors' and nurses' offices, clinics, pharmacy, fully fitted with all necessary equipment for your daily routine checkups, and the living quarters for the nurses upstairs. I would like to also add that the building has been designed to account for the elderly and the handicapped conveniently. From this podium, I am also proud and excited to announce the commencement of the Wesley Housing Scheme in Joe Burton, a project that is so paramount because it is the first step towards the initiation of the airport. Finally, I would like to thank the government of Dominica for entrusting these projects to MMCE in regards of housing, health, and education. And as always, we look forward to continuing to serve the great people of Dominica. Thank you, and have a good afternoon.
Thank you, Mr. Ahmad, for the project overview. We are now at the official naming of the Health and Wellness Center, and I invite Mrs. Terelia Ravalier, the Acting Principal Nursing Officer, to read the citation.
Honorable Roosevelt Scary, Prime Minister of the Commonwealth of Dominica, Honorable Reginald Austri, Senior Minister and Minister for Housing and Urban Development, Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment, Honorable Fidel Grant, Minister for Blue and Green Economy, Agriculture and National Food Security, and Parliamentary Representative of the Wesley constituency. Other honorable members of Cabinet, Mrs. Letitia Lestrade-White,
Permanent Secretary, Ministry of Health, Wellness and New Health Investment. Other Permanent Secretaries, Mr. Ahmad Al-Khatib, Project Manager, MMCE, Dr. David Johnson, Chief Medical Officer, Dr. Laura Esprit, Director, Primary Healthcare Services, Mrs. Magdalene Popon Alexander, Senior Community Health Nurse, Region 2, Mr. Broad Philip, Chairman, Wesley Village Council, Mrs. Imelda James Shillingford, Pharmacist, Nurse Imelda James, Reverend Evans Dodds, other invited guests, members of the media, ladies and gentlemen, pleasant good afternoon. Nurse Imelda James. Mrs. Imelda James, affectionately called Nurse James or Maspa, hails from the tranquil village of Wesley. She was born in 1944 to parents Benjamin and Julia Robin, and is the wife of retired pharmacist Herman James, SPAC. Mrs. James has 3 biological children. However, she has mothered and nurtured many others. Her primary school education began right here in the village of Wesley, and she later journeyed to the Caribbean Union College, now known as Southern Caribbean University, located in Trinidad, where she completed her secondary and college education. Her formal training in nursing began in 1970 at the Dominica School of Nursing, where she successfully completed her training as a registered nurse in 1973. Propelled by her love for the nursing profession, Mrs. James completed the midwifery program and in 1975 became a registered nurse midwife. She also received formal training in eye care, pediatric nursing, family planning, and care of the elderly. Upon completion of her registered nurse and midwifery training, Nurse James was assigned to the Marigot Health District, where she served at the Marigot Hospital and the Health Center for approximately 8 years. She was known as a very caring and empathetic nurse who was committed to patient advocacy and was an ardent advocate of primary health care in the early 80s. In the mid-1980s, Nurse James was assigned to the Wesley Health Center, where she served the community of Wesley. Her passion for patients' health was evident in the quality of care which she gave to her patients. Her love for the people, especially the elderly and children, coupled with her selfless and commitment, was the passion that propelled her into this humble profession and became the driving force that kept her for over 30 years as she gave her best to her community. During her tenure as registered nurse midwife at the Wesley Health Center, Nurse James worked with very much zeal with her patients with non-communicable diseases, especially the diabetics and hypertensives. She organized special diabetic clinics, cooking sessions, and educational programs where her patients and their family members could learn better ways to cope with and treat their conditions. Nurse James was also passionate about childhood immunization and worked fervently to ensure that all her babies whom she delivered were immunized. Her compassion, moral courage, vision, hard work, empathy, and commitment to the nursing profession and her community sets her apart from all else and made her a role model to many nurses. In 2005, Nurse Imelda James was honored with the Meritorious Award for long service in the nursing profession by the government of Dominica. When Nurse James was asked, "What prompted you to become a nurse?" she responded, "I love my people. I love helping my people. And I love seeing my people healthy." This has been her mantra for many decades and still rings true today. Nurse James is a community person, and it is evident that her love for her community was not limited to her profession. As a retiree, she actively participates in the organization and distribution of food and gift baskets. She distributed cooked meals to the elderly and the needy persons, as well as the shut-ins during her visitation. Mrs. James is an exemplary force within this community. She has been a blessing to the people that she served and has given of herself to make her community a better and healthier place. The Ministry of Health, Wellness and New Health Investment, on behalf of the Government of the Commonwealth of Dominica, on this day, March 12, 2021, hereby declare that the new Wesley Health Center be named the Imelda James Health and Wellness Center. The ministry congratulates Nurse Imelda James and expresses thanks for her contribution to healthcare services in the Marigot Health District, to include the Marigot and Wesley communities in the Commonwealth of Dominica. I thank you.
Thank you, Piero. And can we give Ms. James another round of applause, please? I also want us, Ms. James' husband is here, and I think the support he gave also propelled Ms. James to do what she did. Can we give him a round of applause? And Ms. James, I would like to express my own personal congratulations to you and God bless you. I now invite Honorable Fidel Grant, Minister for Blue and Green Economy, Agriculture and National Food Security, and Parliamentary Representative of the Wesley constituency to give remarks.
Good afternoon, everyone. Let me recognize the presence of the Honorable Prime Minister, Roosevelt Skerrit, the Senior Minister, Reginald Austri, the Minister for Health, Dr. Ludwig McIntyre, my cabinet colleagues, other parliamentary colleagues, Permanent Secretary, Mr. Ahmad Al-Khatib, Project Manager, MMCE, and other staff of the Ministry of Health. Good afternoon again. It is with utmost joy and pride that I stand here today to address you. Gathered here for the naming and opening of this Health and Wellness Center here in our beautiful village of Wesley. We cannot boast of having many natural tourist sites, rivers, beaches, and the likes, but here in Wesley, Woodford Hill and Parliamentary, we can boast of being blessed with many of the most hard-working, strong, proud, caring, and industrious people. And today, we are here to celebrate our very own Nurse Imelda James, affectionately known as Maspa. A popular saying is, "Give me my flowers while I'm alive." Today, we honor one of our living heroes, Nurse Imelda James. When I contacted Nurse James to inform her that the Cabinet of Dominica was considering naming the Health and Wellness Center in her name, Nurse was immediately filled with joy. Her first words to me were, "Thank God. After 41 years of service, I am being recognized." Nurse James, on behalf of the Honorable Prime Minister, my cabinet colleagues, all of us here today, and we in the Wesley constituency, I thank you for your service and commitment. Nurse, today we honor you, we celebrate you, and we are indeed grateful for the service you have given to all of us in the community and the Northeast District where you serve. Ladies and gentlemen, I am proud to be part of this visionary administration, for it is only with wisdom which made us prepare for a pandemic like COVID-19. In the first and second quarter of 2020, we witnessed the crushing challenges endured by the most established health systems in the world. On our television screens, we watched day by day, otherwise resilient and first class, fully equipped systems collapsed before our very eyes. In little over 1 year, over 500 people have died in America from COVID-19. Over 1 million deaths in the world. And we do sympathize with all these families across the world who have lost loved ones due to this dreaded disease. We sympathize with governments where the economies were driven to ground zero because of the impact of COVID-19. As has been demonstrated by the Honorable Prime Minister, through this we have been sharing COVID-19 vaccine with sister islands. We stand firm in support of countries which are grappling with this disease. Dominicans, we are not out of the woods yet, but we have every reason to be proud of ourselves, to be proud of our frontline workers, and to be proud of our policymakers, your government. Ladies and gentlemen, the opposition elements have said, we will see thousands of people falling ill with COVID-19. These preachers of doom and gloom, they told the nation that many Dominicans will die from this dreaded disease. These people said that our health system would sink under this pandemic. But, just like many times before, we have proven them wrong. Again and again, Dominicans, we will again prove them wrong. And that is why today, our country is leading in the fight against COVID-19. Governments are turning to Dominica for advice and guidance. Dominicans, despite the odds that we have faced, from natural disasters, economic recessions, COVID-19, we continue with all our safety net programs, and I am grateful. We in the Wesley constituency, we are grateful for the Yes We Care program, where over 70 of our elderly persons are receiving care. The constituency of Wesley is grateful for the National Employment Program. We are grateful for the pension our citizens who are 70 and over receive. For many of our citizens, the pension and the Yes We Care program is the only source of income and care they receive. In the Wesley constituency, we are grateful that right now we have over 15 university students around the world who are benefiting from financial assistance. We have 3 young people from the Wesley constituency studying medicine in Cuba. We continue with the housing revolution, building homes for young and single mothers and children who will not be able to do it on their own due to the social circumstances. We are indeed grateful. If these are not first world country opportunities and privileges, I do not know what is. Brothers and sisters, despite the numerous actions from a very sinister opposition party, Dominica will continue to rise. They said that we will not build a stadium. They said that we would not build a hospital. They doubted that we would have built health and wellness centers. But here we are today, celebrating the opening of 5 out of 12 new health and wellness centers. And ladies and gentlemen, my constituents, I say to you, that not too long from now, we shall see the movement of soil, we shall see construction, and we shall again gather on the soil here in Wesley for the construction of our international airport. In the words of the Prime Minister, ladies and gentlemen, the airport we shall build. Dominicans, your Labour Party government keeps its promise. Your Labour Party government delivers on its commitment to make your lives better and to build a dynamic Dominica. We have made considerable strides in the negotiation and settlement phase of the residents who have homes and are being affected. We have paid in excess of $5 million to homeowners and over $300,000 to crop farmers. We continue with the reallocation of lands for farmers who continue to farm and who wish to venture into agriculture. On another occasion, I will provide you with a more in-depth information, but not today. But today I want to place on record my deep gratitude to the people of Wesley, Woodford Hill, and Parliamentary for your cooperation in the movement towards building a dynamic Dominica. This new and modern health and wellness center is just the beginning of things to come. I have the commitment of the Honorable Prime Minister and the Minister of Finance to implement sustainable employment projects right here within the communities. We will roll out training in plumbing, tiling, sewing, electricals, and cooking, thereby empowering you with income learning skills. In a few weeks, we will launch our new cooperative. I have also been seeking and have formed benefactors who are willing to support this constituency. They are already helping with the improvement of farm access roads. So earlier this week, we began work on the Mambri Feeder Road. This road provides access to over hundreds of acres of prime agricultural land, both privately owned and state-owned. So young men and women of this constituency can go back to the land and plant and earn a living. I encourage you, my constituents, let us continue working with this government. Let us strive. Together, let us empower ourselves and take advantage of the opportunities for growth. The development of Wesley, Woodford Hill, and Parliamentary is not an organization. It is okay to call yourself the brightest brain of Wesley. But in order to develop a community, in order to grow anything, you must learn to love it, nurture it, and care for it. That, my dear people, is my commitment to each of you. I urge you to take care of this beautiful facility. I urge you even more to make healthy choices. I encourage each of you to go out and get vaccinated. Let us return to the land. Let us plant what we eat and eat what we grow. Parents, let us return to the days when we made fresh local juices for our children and homemade treats. The Ministry of Agriculture is engaged in a massive propagation exercise in an effort to make thousands of fruit trees available to the nation. Please get your plants when that time comes. Nurse James, once again, to you and your family, I say congratulations. I thank each of you, young men and women from the National Employment Program, who have beautified the surroundings of this facility. You have done a great job. Thank you. I am proud of you. I thank the Honorable Prime Minister and my cabinet colleagues and our parliamentary colleagues who have attended this ceremony here today, the Ministry of Health for its event, and each of you, my constituents, for your support. Thank you and have a good evening.
Thank you, Honorable Minister Grant. I now invite Honorable Dr. Irving McIntyre, Minister for Health, Wellness and New Health Investment, to give remarks.
Thank you, yes. Let me recognize the Honorable Prime Minister, Sir Roosevelt Skerritt, Honorable Reginald Austria, our Senior Minister, Honorable Fidel Grant, Minister for Blue-Green Economy, Agriculture, National Food Security, and Parliamentary Representative of the Wesley constituency, other honorable members of Cabinet, Mrs. Letitia Lestrade-White, Permanent Secretary, Ministry of Health, other permanent secretaries, Mr. Ahmad Al-Khatib, Project Manager MMCE, Dr. David Johnson, our Chief Medical Officer, Dr. Laura Esprit, our Director of Primary Healthcare, Dr. Bekele, our District Medical Officer, Mrs. Terry Ravalier, Acting Principal Nursing Officer, Mrs. Magdalene Popon Alexander, the Senior Community Health Nurse, Region 2, Mr. Brad Phillip, Chairman, Wesley Village Council, Mrs. Alia Jane Shillingford, Pharmacist, Ms. Imelda James, Reverend Evans Dodd, other staff of the Ministry of Health, members of the media, ladies and gentlemen, pleasant good afternoon to all. To you, the people of Wesley, a special good afternoon to you. The truth is, we are here only because of you. Without you, there is no need for a health and wellness center. And secondly, we are here today because we care about your health and your well-being. As a government, we have always put the people first, and by doing this, your health and wellness becomes our priority. Just like we have been taking care of your housing needs, education of your children, taking care of the elderly, social programs, and your infrastructure and safety, and all other aspects of development, your health is no exception. That too is being done within a pandemic period, within a time when most of the world is still under some sort of lockdown, if not complete. But we're very pleased to be here today because we know how deserving and patient you've been for your new health and wellness center. It is very comforting and brings great joy to our hearts. Your government has put you, the people, first in everything that it has done. This is the 5th new health and wellness center to be commissioned out of a total of 12. And as this is all part of the bigger picture the Ministry of Health and the Government of Dominica has for health as regards to decentralizing healthcare in Dominica. Making healthcare available to everyone, everywhere. That is you not having to travel long distances to get the services that you need. Services that can be done and will be done right here at your Health and Wellness Center in Wesley. A facility that is even equipped with cardiac monitors and dental services as well. This is the level of services being provided to you, the people of Wesley. Another very important aspect of your new Health and Wellness Center is the accommodation for your nurses on duty right upstairs your new health facility. Excellent accommodation so they are comfortable and happy when they attend to you. But just as important is that they are right there and within seconds they can attend to your needs. As I said earlier, in health, time is of the essence. Also to note, a very significant component is the climate resilient aspect of your new Health and Wellness Center, such that after a natural disaster, like a hurricane, when you need the services even more, they will not be interrupted and your care will continue. Your Health and Wellness Center is part of the Ministry of Health's new vision for the healthcare in Dominica. A healthcare system that not only focuses on the absence of disease and treating disease, but a healthcare system that promotes healthy lifestyle, good habits, and attitudes. This is going to be the platform from which primary healthcare will see its new vision and propel its mission in providing healthcare to you, the people of Wesley. A healthcare service that is interactive, one that will focus on prevention rather than cure. A primary healthcare service in which health education and promotion will play an integral part in the delivery of services. A service that will address our behavior and help us adjust and adopt healthy lifestyles. A service that will engage in regarding how we eat, how we exercise, and the way we live our lives and prevent disease. But you, the people, the beneficiaries, must play your part as well. You must attend your clinics. You must take the advice of your healthcare workers. And very importantly, you must own your Health and Wellness Center. It belongs to you. Take care of it. Don't litter it and don't deface it. It is also important to note that with the completion of our 12 new Health and Wellness Centers, we'll have the most of these facilities per population in the entire region. As a nation, we should be proud. And you must also remember, all of this is being done and is made possible with funds from the CBI program. So you, the people, have a vested interest in protecting and defending our CBI program. Although we are here today to commission the new Health and Wellness Center, allow me some latitude and permit me to mention our vaccine rollout program. As a nation, we have truly been blessed to be in a position where we are providing COVID-19 vaccines to our people. Many of our other countries, are still waiting to receive their first vaccine, let alone to begin their vaccine rollout program. As a matter of fact, over 130 countries have not even received their first vaccine as yet. Here we are in Dominica, with our vaccine rollout program in full progress, to the extent that we have even helped some of our sister islands by providing vaccines to their frontline workers. We should not take this for granted. We should be grateful and thankful and appreciate the luxurious position we're in today as regards to fighting COVID-19. We've had no deaths, and vaccination is one of the ways we can keep it that way. We're extremely pleased with the response so far from the public, and must thank you, the people, for acting responsibly and taking part in the biggest vaccination program this country has ever seen. Our vaccine program is voluntary, and some individuals may have their reservations regarding the vaccines, and in all fairness, this is understandable. However, it's all about saving lives and getting back to normalcy and optimal productivity. We're in the middle of a pandemic. This is not time for distractions and trying to score cheap points. Your government is focused on protecting you as the citizens of this country, and will do so by all means necessary. My dear people, help us to help you. Make use of your new Health and Wellness Center. Take advantage of our vaccine program and let us build a healthy nation. I would like to thank MMC for a beautiful final product. I would also like to thank the entire health team and planning committee for today's event. And deepest thanks goes out to all our frontline workers who've been working tirelessly to keep us safe. But today, the most special thanks goes to you, Ms. James, for a job well done. In your citation, it was mentioned that two of your areas of interest was immunization and food and nutrition. And this is the basis, well, some of the basic factors and aspects of the primary healthcare system that we're out to roll out here. So your interest fits in very well with our vision for a better primary healthcare system, which is nutrition and immunization. And it fits in even better now that we're in the biggest immunization program that we've ever carried out in this country. So once again, thank you very much. God bless you, and I thank you all.
Thank you, Honorable Minister McIntyre. I would now like to invite the students, a few students from the Wesley Primary School, who are going to do a performance for us. Ministerial, the Prime Minister and Minister for Finance to deliver the feature address.
Thank you very much. Let me first of all recognize Honorable Reginald Austria, our Senior Minister, Honorable Dr. Urban McIntyre, our Minister for Health, Honorable Phil Grant, our Parliamentary Representative for the Wesley constituency, my other Honorable Cabinet and Parliamentary colleagues, and in particular, Honorable Kent Edwards, our Parliamentary Secretary in the Ministry of Health, Mrs. Letitia Lestred White, the Permanent Secretary in the Ministry of Health, and other Permanent Secretaries, my friend, Ms. Ophelia Benjamin, Mr. Ahmad Al-Khatib, the Project Manager of MCE and the staff, Dr. Johnson, our Chief Medical Officer, Dr. Esprit, our Director of Primary Health Care and staff of the Ministry of Health. I also see Dr. Benjamin and his wife here. Reverend Dr. Evans Dodds, Mr. Philip, our Chairman of the Village Council and other councillors. I want to especially recognize, I think it's Mr. Williams, the teacher of the Wesley Primary School, and the wonderful students of the Wesley Primary School. I must say that Mr. Williams has been a pioneer of culture in Dominica for several decades. I will thank him for passing that on to our children. Ladies and gentlemen, but I left the best for last. And my dear friend, Nurse James. You know, I've known Nurse James for some time now. Mrs. Imelda James. And I was just saying to our power rep, in retrospect, I believe we should have named this facility in both her and her husband's honor. Because Sparky has made a tremendous contribution to Dominica's life. And I think I may invoke my constitutional authority and name this facility in honor of both of them. Because the reality is, I have never seen Sparky without Ms. Sparky, and I've never seen Ms. Sparky without Mrs. Sparky. You know, and they have made such a great contribution to not only to this wonderful part of Dominica, but the whole of Dominica. And I'm so happy that this government is recognizing these individuals for their contribution in a tangible way, and for current and succeeding generations to appreciate these people, and the hope of emulating what they have done. Because we spend so much time in this country complaining rather than thanking God for what He has given to us, with the hope that He will bless us even more. And Nurse James worked under very difficult circumstances, but never complained until today. And so Nurse, I am so happy to be here to celebrate with you and your family, and to say thank you on behalf, you know, for your contribution. You know, words cannot express our gratitude to you, but by this manifestation, it's an expression of our thanks and gratitude to you for your contribution. So I really believe it would be strange to say Nurse Imelda James Health and Wellness Facility and leave Mr. Sparky out. You know, so we will certainly take note of this and maybe correct a slight oversight on our part. But I really wanted to take some time off to salute both of you for your so many decades of contribution to Dominica's development. And I consider myself to be very fortunate as an individual to have had the occasion to interact with these wonderful human beings. And in my interactions, you know, always learn a lot from you, Nurse James and your husband. So humble and never complaining, pressing on, you know, focused on educating your family and investing in education in your family. And I really want to commend you for this, and may God continue to keep and bless you for the many more years that you will be with us. But my dear friends, it is a pleasure once again to be with you, the people of Wesley and the surrounding areas, especially this time on such an important occasion. The opening of the Wesley Health and Wellness Medical Center is one of 12 such facilities that this government will commission in the first quarter of this year. And this once again emphasizes our ongoing commitment to the delivery of excellent primary health care. The Dominica Labour Party government has always believed from the very onset that healthcare and education are the foundation of any developing society and the bedrock of our efforts at empowering our people. This is why we have conscientiously embarked on developing the most comprehensive community healthcare network per capita that can be found anywhere in the Caribbean and beyond. You may have noticed that we are also placing emphasis on the issues of wellness, because we believe that ultimately our successes will be judged not only by how we care for our people when they're sick, but what we as a community do in helping to keep people from getting sick. We recognize that adequate emphasis had not been placed on the concept of wellness in our health management systems. And so, moving forward, there will be special emphasis in that area. Culturally and particularly among our men, we have only sought to interface with the national medical system when we are not feeling well. However, we must pivot to a system where annual checkups become a routine. Indeed, our primary healthcare system must be able to intervene in helping people from becoming violently ill to the point where they require hospitalization and other such services. The issue of promoting wellness must be the central component in our overall health policy. And this must include the dissemination of information and the development of general health awareness among our people. The bulk of the health challenges in this country are as a result of lifestyle diseases. Conditions such as diabetes, high blood pressure, cancer, and so on. These non-communicable diseases are commonly caused by lack of physical activity, unhealthy eating habits, alcohol, drugs, smoking, and the like. We believe that this health network we are expanding must not be seen only in these impressive buildings, like the one here at Wesley, as important and as significant as they are. What they are is the infrastructural support system and the juncture where awareness meets intervention, where not just medical doctors, but health awareness offices, nutritionists, physical therapists, fitness guides interconnect with the broader population. Centers like this one here are crucial in developing a network that assists in controlling local endemic diseases and are key in the provision of maternal and child health care in particular. Our guide in building a strong and more sustainable economy leads to a healthier, more productive society. A community that places more emphasis on nutrition and diet, physical activity, and the proper management of the environment. However, as important as the role of government is, a lot of this also calls for commitment and conscious community action, and indeed personal responsibility. And speaking about personal responsibility, I also want to use this occasion to appeal to the wider general population about the significance and the importance of participating in the ongoing vaccination exercise for COVID-19. While we have been very encouraged for the large part in the participation of our people, we still find that there are significant pockets of vaccine hesitancy among many people. Taking the vaccine is not only significant for everyone's personal health and well-being, but it is also crucial in helping us to achieve the goal of fully reopening the economy and returning to a semblance of social and economic normalcy. As a matter of fact, the cruise ships are inquiring as to how many people have taken the vaccines in Dominica as part of their planning of the return of cruise ships to our region. And that I suspect may very well be a prerequisite of their coming in to our jurisdictions. While we have kept the numbers of infections relatively low, this pandemic has had a devastating effect on livelihoods and has set us back in our development goals. Our best chance at return to normalcy is through more than 70% of our population being inoculated. There continues to be a lot of rumor and false reports circulating about the vaccine, none of them borne out by any data or any objective reality. The safety of the vaccines available to us has been firmly established, and the rollout of the processes across many nations, including our own, has indeed been a smashing success. I have every confidence in our people remaining, to use the urban contemporary word, woke, when it comes to this issue. If any one of you still has any doubts, then you should talk to your trusted medical practitioner. The same ones through the years who have been there guiding you on medical issues for your children, yourself, and the elderly. Ladies and gentlemen, this may be challenging times, but it is also a time of unique opportunities and endless possibilities. As a progressive government, we are determined to continue to lead from many fronts in our endeavor to build not just another society, but a just and equitable society. The people of Wesley can be justifiably proud in the work and the delivery of this government, with the work in this area being led by our Parliamentary representative, Honorable Fidel Grant. Indeed, this area has received and will continue to receive its fair share of all the major projects and initiatives of this government. You continue to benefit from the Agricultural Livelihoods Project, funded by the World Bank, scholarships for university studies, and housing assistance, and of course the construction of new homes, just to name a few. But there will of course be more than that. The biggest infrastructural project in the history of this country is taking place right here in this community. The construction of the international airport will completely transform this nation in ways yet unimaginable. And its biggest impact, both in the construction phase and beyond, will be felt right here in this wonderful village of Wesley. Currently, we're engaged in preparatory and preliminary works that will lay the foundation for this project. All project management aspects are now being consolidated. As you're aware, we have also been closely engaged in the community, and our widespread discussions with farmers and homeowners are ongoing. We have been very heartened by the response of the people who have had to be relocated to facilitate the airport's construction. We have already given the go-ahead for the construction of 37 new residences for people who have had to be relocated. We continue to work closely with all the families and all the people who have been affected, and we thank them for their cooperation thus far. There are those who have opted for cash in exchange of their properties, and we are also working with them. I have always been inspired, my dear friends, by the sense of community and solidarity that have been displayed by you, the people of Wesley. In that regard, you have remained consistent and have provided a light for many of us. Your enduring faith in the worst of times and in the best of times has always lifted us up, and you are central to what this nation has always been, a beacon of hope and endurance. I want to also place on public record my sincere appreciation and confidence in the representation being provided by Honorable Fidel Grant. And I say one of the things I am certainly impressed about him is an unassuming individual, but very profound and very, very understanding of what development truly means, and his determination on working on transformational projects and programs that can sustain the livelihoods of the wonderful people of Wesley, Woodfordale, and Parliamentary. And I think in him, you're in good hands. I also want to commend the leadership of Honorable Dr. Irvin McIntyre, especially in these very trying and difficult times. And his steady hand is certainly seen us through the most difficult pandemic, the worst pandemic we have seen in our history. And we're going to commend his leadership and, of course, the administrative leadership of the Ministry of Health. Ladies and gentlemen, we in this country, we have many things to give God thanks for. And we must always see the glass half full. Seeing the glass half full is a recognition of our gratitude to the Lord for what He has given to us. Because if we do not thank the Lord for that which is given to us, and we complain about that which we have not received, you may have a difficulty in receiving anything that will satisfy you. Let us give God thanks always. And here it is. In the most difficult period, we're here in this wonderful village of Wesley, commissioning a brand new health and wellness center that will enhance the delivery of primary health care and wellness services to our citizens. And we have placed the cherry on the icing of the cake by recognizing a patriot in practice, this Imelda James, someone who has given so much to so many of us over such a long period of time. And let us, as young people, these are the people that we need to emulate. People who have worked hard diligently, stayed in Dominica, helped in this country, and who continue to make a contribution in the community and in the church. Let us emulate this. And in due time, both the nation and our Lord will bless us for our contributions. May God bless the wonderful people of this constituency. May God bless the call for Dominica. I thank you very much.
Thank you, Honorable Prime Minister. I now invite Mrs. Imelda James pharmacist in the Maribor Health District, serving also the Wesley Health Center. And Mrs. Alia James Shillingford is also the daughter of Nurse Imelda James.
Honorable Roosevelt Skerrit, Prime Minister of the Commonwealth of Dominica and the Minister of Finance, Honorable Reginald Austri, Senior Minister and Minister for Housing and Urban Development, Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investments, Honorable Fidel Grant, Minister, Blue and Green Economy, Agriculture and National Food Security, and Parliamentary Representative for the Wesley constituency, other honorable members of Cabinet, Mrs. Letitia Lestrade White, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, other Permanent Secretaries, Mr. Ahmad Al-Khatib, Project Manager for MNCE, Dr. David Johnson, Chief Medical Officer, Dr. Laura Esprit, Director, Primary Healthcare Services, Mrs. Terilia Ravalier, Acting Principal Nursing Officer, Mrs. Magdalene Popon Alexander, Senior Community Health Nurse, Region 2, Mr. Brond Philip, the Chairman of the Wesley Village Council, Nurse Imelda James, our honored guest, Reverend Evans Dodds, other invited guests, members of the media, ladies and gentlemen, and my community of Wesley, good afternoon. Today, I stand here filled with so many emotions. I am humbled, honored, ecstatic this afternoon at the opportunity afforded me to offer words of gratitude on the occasion of the formal opening and naming of the Wesley Health and Wellness Center. Firstly, as the daughter of Mrs. Imelda James, it is with the greatest of pride, joy, and happiness that I say thank you to the Prime Minister, Honorable Roosevelt Skerrit, the Ministry of Health, and by extension, the government of Dominica and the community of Wesley for bestowing the honor of naming this facility after my mom. In the 1980s, my mom could have left, like so many others, in search of greener pastures. But she stayed and she helped build her country, her community, and healthcare in Dominica. She has touched the lives of so many persons through both her professional and her personal life. Her empathy, her charisma, and her love for others are just a few of the attributes that make this woman, whom I call Mom, stand apart from all others. I have lived with her passion. I have experienced her selflessness and commitment to healthcare, and I too share her love for a healthier Wesley community. This is your legacy, Mommy. Well done. So on behalf of my mom and my family members who are present here this afternoon, I say thank you. I express thanks to you, Honorable Roosevelt Skerrit, for sharing this occasion and for delivering such an inspiring feature address. To the Honorable Dr. Irvin McIntyre, we thank you for your presence as well and for delivering remarks. To the Honorable Fidel Grant, our Minister for Blue and Green Economy, Agriculture and National Food Security, for delivering remarks in your capacity as Parliamentary Representative for the Wesley constituency. Thank you, and we are proud of this accomplishment. Secondly, as a member of the Maribor Health team, I must express my sincerest gratitude. We have watched with quiet anticipation the development of this fine structure from its initiation. We now have an improved facility where we can offer more effective, comprehensive primary health care services. It is my hope that we can now offer augmented care in the areas of child and maternal health, non-communicable diseases, as well as the efficient provision of free essential medicines to the population. To my colleagues, I leave these few words from my mom, Mrs. James, and I quote, "Give your best service from a heart of love." So from the administrative team and members of the Marigot Health District, I say thank you to Mr. Ahmad Al-Khatib, MMCE, the government of Dominica, as well as all other entities who were instrumental in bringing this facility to completion. Thirdly, as a part of the Wesley community, I must express the deepest appreciation of the Wesley people for this center. We have waited with the greatest of expectations. This is ours. We claim it, and we will care for it as we benefit from it. From my Wesley people, I say thank you. Finally, to all the persons who in one way or another made this special occasion a success and a memorable event. To Mrs. Letitia Lestrade-White, the Permanent Secretary in the Ministry of Health, for the effective moderation of this activity, I say thank you. To Mr. Bron Phillip, the Chairman of the Wesley Village Council, for your warm words of welcome. To Ms. Chelsea Prince, for leading our national anthem, and to the Wesley Primary School for your wonderful performance. To Mrs. Sorelia Ravalier, the Principal Nursing Officer, for presenting this wonderful citation in honor of my mom, Mrs. Imelda James. To Reverend Evan Dodds for your prayers and blessings on this new facility. And to the auxiliary staff, our NEP workers, and everyone else who contributed in creating this wonderful ambience for this activity today. From my heart to yours, I say thank you. May God bless each person here present, and may God bless Dominica. Thank you.
And I say thank you to you, Mrs. Maria James for giving us the good thanks. Well done. We'll now have a presentation of bouquet and food basket to Nurse Imelda James. I now invite the Honorable Prime Minister, the Honorable Minister for Health, Wellness and New Health Investment, Ministers of Cabinet, Members of Cabinet, and also Mrs. Dodds, Mrs. James, to the front of the Wellness Center where we are going to do the unveiling of the plaque, blessing of the facility, and the cutting of the ribbon.
Hello. Let's go. Yes, and we're about to see the unveiling of the health and wellness facility, the plaque, to mark the official commissioning of the health and wellness facility here in Wesley, the Nurse Imelda James Health and Wellness Facility. At the front is Nurse James and her husband, known in the Calypso world as the Spark. He was a pharmacist by profession, and he's standing with his wife. They have made a tremendous contribution to the development of healthcare in Dominica. Reverend Dodds will lead us in prayer, and we will get soon the unveiling of the plaque.
Father, bless this medical center so that it may be a place of healing and caring. Be with all those who are suffering, that they may receive strength and courage to face their illnesses. May all the caregivers provide gentle hands and caring hearts, so that there may be a blessing to others with whom they come in contact. Dear God, we seek your help and intervention on behalf of this facility. We pray for all the physicians and nurses and healthcare workers and providers, for all who are involved in providing care for those who are sick. Please grant the medical team wisdom to know the best course of action to relieve pain and promote healing. And in their knowledge, we ask that they may do what is best for all who are sick. And in their knowledge, may they know that if they fall short, that they can ask you, that you would close the gap and provide wisdom and insight and guidance into every situation they face. We know that you are a good God, the one who loves all your children. Please comfort them in difficult times, and we ask you to ease their pain and give them hope and peace. We thank you, God, for all who have provided money and all of the help that was needed. Please continue to increase their storehouse, that they may have more to give and give again. Bless those who have labored and toiled each day and night to bring this project to completion. God, we thank you, and we ask for your blessing upon this facility, this medical facility, in the name of the Father, and of the Son, and of the Holy Spirit. Amen. Put some water.
You just see now the blessing of the building by Reverend Evans Dodds, Methodist minister, and he's blessing this building for healing and caring in the community of Wesley. And the plaque is about to be unveiled. The plaque is about to be unveiled, and we should be able to see Nurse James unveiling the plaque on the building that now bears her name. And so, if you will turn off my mic. And we have seen the unveiling of the plaque, the Imelda James Health and Wellness Center, and very soon we will see the cutting of the ribbon for the Health and Wellness Center, and we see the little girl, seems to be the granddaughter of Nurse James, for the unveiling and the cutting of the Imelda James Health and Wellness Center. The ribbon has been cut. The little lady is very excited indeed, and we now see the doors being opened to the Imelda James, the Nurse Imelda James Health and Wellness Center, and Nurse James, her husband, and her granddaughter, the first to enter, as we see now Prime Minister Skerrit enter, along with the Parliamentary representative, Honorable Fidel Grant, as well as the Minister for Health and Wellness, Honorable Dr. Irvin McIntyre. So it is official, the Nurse Imelda James Health and Wellness Center, in honor of Nurse Imelda James, in recognition of her dedication and outstanding contribution to the health services nursing in the Commonwealth of Dominica, commissioned on March 12, 2021, funded by the Government of Dominica through the Citizenship by Investment Program. So this is what is going on now in Wesley. It is official. The Nurse Imelda James Health and Wellness Center, the doors are officially open. The doors are officially open, and a number of people have made their way here to Mopo in Wesley as we see the commissioning of this Health and Wellness Center. And it is indeed wonderful to be here at this event in Wesley, in Mopo in Wesley. We see a number of medical professionals. Very close to me is Dr. Griffin Benjamin, the consultant psychiatrist. Dr. Benjamin, what are your thoughts on this facility?
I'm very proud of the event. My aunt.
Oh, your aunt, congratulations.
Nurse James,
yes.
Been named after her. So I feel it an honor for all of us.
Yes.
You know, we just lost our mother, her sister. About a month ago, we buried her. So now this is just helping our family to feel accomplished, to feel a sense of pride, a sense of devotion to community. And our aunt has been our rock in all the years of our development. Most of us lived with her for our school years. She was the first member of our family to go to college. And she went to Trinidad, and that was in the 60s. So my mom was extremely proud of her, and she made us recognize her as the example, the one that we had to follow. And so we all got a chance to live with her while she was a nurse, live with her while we were in high school, and her husband, Sparky, he was like a father to many of us. And so after Auntie Imelda, we have about 6 or 7 other family members who have become medical doctors. Many have become nurses, and many other type of professions. And it's all because of the dedicated commitment and hard work of Auntie Imelda. So I'm very proud to be here.
Thank you, Dr. Benjamin. He's saying he's very proud to be here. We're going to try to get a hold of Nurse Imelda very soon. But once again, the Health and Wellness Center, commissioned here in Wesley, in Mopo in Wesley, the Imelda James Health and Wellness Center, commissioned in Mopo, received training, began training as a nurse in the 1970s. By 1975, she had qualified to be a nurse midwife, started off in the Marigot Health District, and later on moved to Wesley. So Nurse Imelda James made a significant contribution to the healthcare development in this part of the nation, which included 41 years of service in nursing and midwifery here in Wesley. She was a model example for nursing. It also included her advocacy for the treatment of non-communicable diseases, in particular diabetes and hypertension. The wife of a well-known pharmacist as well, Mr. Sparky James there. So quite a bit of things going on here. Very soon we'll hopefully be able to speak with Nurse James and probably her husband as well. Yes. Very happy to be speaking with Nurse Imelda James at this time. Nurse James, Daryl Titt of the Government Information Service.
I heard about Daryl Titt all the time, so I'm pleased to meet you today.
Oh, I am even more pleased to meet you, Nurse James. Congratulations on the naming of this facility after yourself. How do you feel at this time?
Oh, I feel elated. I cannot complain. Because seeing this building today, I wish I was younger. Because I have worked under so much conditions compared to this. But in everything, God said give thanks. And I was happy when I did it. So I'm okay.
Tell me about your time as a nurse, 41 years as a nurse. Tell me about your time.
Okay, when I came first in the district, that was 1973, 75, because I went back and did my midwifery, and then I came back in 75. When I came back, there were two nurses in the Margaret Hospital, Sister Africa and Miss Musgrave. And when they would come, like this morning at 8 o'clock, they would have to see work the whole day and the night, and then the next day, the other nurse will come and relieve. So two of us who passed our exam, they sent us immediately to Margaret, and we had to join that. But it was exciting, and I did enjoy it, right? But Margaret Hospital, I did enjoy it, as I worked 10 years in the Margaret Hospital, and then I worked on the district, and then I came to Wesley, and I worked 31 years in Wesley.
31 years in Wesley. 31 good long years?
Long years.
Yes.
And when I came to Wesley, it wasn't easy. It's not like you have sterilizing and those kind of things. And it's not to say you had to send patients to town. We had to deliver. All of our deliveries were done at home, except emergencies or high-risk patients. We take them down. But all our deliveries had to be done at home. Sometimes when we want to send our patients to town, the nurses will say, why are you sending them? Deliver all the patients. But we feel happy because today in my community, there are a lot of persons. Sometimes they'll just kiss me or send a gift. I say, who sent this gift? And the person would say, well, you were the one who delivered me, and I'm so happy. And we have gone through that. But working in Wesley was a very, very, very challenging one, and I did enjoy it.
What would you like to advise young nurses entering the profession at this time?
There are lots of things I would encourage them. Sometimes people come at my home and they complain, say, Nurse James, if you were there, and and the nurse, I would then ask my nurses to love their patients. Put yourself back and put them number one at the front. That's what I used to do when I was a nurse. When the patient would come and complain, I would put myself behind. Sometimes just a little encouragement, advice. Sometimes some of them come at them and they have got nothing to give their children. You have a little $5 to give them and they feel better. They're not sick again anymore, They'll go. So love their patients, love their clients when they come. That's what I did.
Thank you, Nurse James, and once again, congratulations.
Thank you. Thank you.
Thank you. Nurse Imelda James, the celebrity of honor here today, the person of honor here today, as we commission this 5th health and wellness facility, this time in Mopo in Wesley. The Imelda James Health and Wellness Center is officially commissioned, and of course, we'll allow you to see some shots of the facility as we have compiled for you thus far. On behalf of all of us who made this broadcast possible, including our editor, Edward Philogen, cameramen, Mr. Ashton Shillingford, Anthony Richards, and Albert Toussaint, our production assistants, Dezan Pelty and Clyde John Baptist, and our man back at the GIS studios, Mr. Nigel Hippolyte, we return you to Master Control after we take in some shots of this new health and wellness facility in Mopo in Wesley, the Imelda James Health and Wellness Center.